Welcome back, everyone. Ready for another deep dive? This time, we're going to be tackling community health assessments. We've got a fascinating case study to really dig into. Get ready for some serious aha moments.
And maybe a few twists and turns along the way. It's incredible what you can learn about a community's needs and strengths just by taking a deep dive into data. It's like the first step toward making a real difference.
Absolutely. Our case study today, the multilingual project. So picture this. A bustling apartment building, low-income neighborhood, families speaking all sorts of different languages, all navigating, the joys and the challenges of prenatal and postnatal health. And this project, it aims to uncover their unique needs and create a roadmap for better support.
The really cool thing about this case is the data they used. It's like a mix of big picture stuff from secondary sources and then those up-close details that they got directly from the community.
So it's like starting with a satellite view to see the whole landscape, then hitting the streets to get that ground-level perspective.
You got it. They use things like existing sociodemographic stats, health records, even relevant policies to get that initial picture of the community's health. But they didn't stop there.
Because sometimes the most valuable stuff is hidden in plain sight.
Exactly. They went right into the community, walking the neighborhood, mapping resources, even interviewing key players, volunteers, city support workers. It's like putting together a puzzle, right?
Yeah.
Each piece of data adds another layer to the story.
Talking to the women themselves must have been incredibly valuable.
Absolutely. And this is where it gets really interesting. They use this method called progressive inquiry. Basically, they started with general questions, and then, based on the answers, they would tailor their follow-up questions.
Yeah.
Like a detective following a trail.
So it's like a back and forth, right? The conversation evolves as they learn more. But how did they even begin to make sense of all this data?
They have this system, this 4-phase analysis system. It's really clever. First, classification. Think of it like sorting through evidence, separating background info from the concerns, those potential risks or problems, and the strengths the community can build on.
So it's not just a jumbled mess. They're like creating order out of chaos.
Exactly. And in the multilingual project, this classification phase, it revealed some interesting things. For example, secondary data showed limited access to prenatal care, which is obviously a concern. But the primary data, it showed that these women, they were super interested in learning about healthy eating. They really wanted to make good choices for themselves and their babies.
So even in the face of challenges, there's still hope. But how do they boil all this information down to something manageable?
That's where summarization comes in. Basically creating concise summaries of all those interview transcripts, questionnaires, observations, highlighting the key patterns and trends.
So instead of reading through pages of notes, they have a clear picture of what the data is saying.
Right. And in this project, they found that 18 out of 20 women were worried about access to fresh produce. Pretty clear signal, wouldn't you say?
Definitely raises a red flag. But they didn't just stop there, did they?
Oh no, they dug deeper. The next phase, interpretation. That's where the aha moments come in. Connecting the dots, analyzing the patterns, and drawing conclusions from the evidence.
So it's like putting on their detective hats, searching for clues to solve the mystery of the community's needs.
Precisely. And in this case, they saw this trend. Many women asking about healthy breakfasts and snacks, but also worried about, affording healthy food. So the team, they put it together. Difficulty accessing healthy food.
It's like reading between the lines, uncovering those needs that aren't always explicitly stated. But wait, there's still one crucial step missing, right? How do they make sure they're not just pushing their own interpretations on the community?
That's where validation comes in. They take their conclusions, their hypotheses, and present them back to the community for feedback. It's vital. Make sure everything's accurate and relevant.
So it's a partnership, researchers and the community working together.
Exactly. And with the multilingual project, when they shared their findings about food access, they got immediate validation. Some women were like, yep, finding affordable, healthy food is a huge challenge. This solidified their issue for action, improving access to healthy food for these moms and their babies.
So it's like they cracked the code, found the root cause of the problem.
They did. And now they have the knowledge and the community support to create real change. But going from data to action, it needs a bridge, a roadmap.
Cue the action statement. Tell me more about these.
Action statements are like the linchpin between analysis and taking action. Clear, concise, and laser-focused on creating change.
Okay, I'm intrigued. What does a good action statement look like?
It's all about being specific. First, it identifies the community. In our case, it's pregnant women and those with young children in that specific building, not just mothers in general, this specific group.
Like zooming in on a map, getting to the heart of the matter.
Yes. Then they state the concern or the strength that they have found. So something like experiencing difficulties in obtaining healthy food, or maybe expressing a strong interest in learning about healthy food.
Highlighting what needs attention, right.
Exactly. And finally, they pinpoint a factor contributing to that concern, something that can be changed.
This is where the rubber meets the road, yeah. Not just stating the problem, but finding a way to fix it.
You got it. So instead of saying there's a lack of healthy food, which is too broad, we might say.
How about? There's a lack of clear information about affordable, healthy food options within walking distance.
Perfect. That's a great example. Now we have a place to start. We can focus on providing that information, connecting these women to resources, maybe even advocating for policy changes.
It's amazing how one well-crafted statement can make a complex problem seem manageable. But this is just the beginning of their journey, right?
Oh yeah, we've only just scratched the surface of the multilanguage project. Stick with us as we dig deeper into their validation techniques, their decision-making process, and the incredible impact of their work.
So last time we were talking about the multilanguage project team uncovering this crucial insight. The women in this low-income multilingual apartment building, they were having trouble accessing healthy food. And they came up with that super clear, actionable statement, the one to guide their next steps. But it's not just about, the numbers and the reports, right?
Right, not at all. What's really cool about this project is how they make sure the community is involved every step of the way.
Yeah.
Remember we talked about that validation phase, making sure the community's voice is actually heard? Well, they took this really creative approach to it. I think you'll find it fascinating.
I'm all ears. Tell me more.
Okay, so instead of just presenting their findings in a dry academic way, they decided to make it interactive and visual. They made these 4 cards, each one representing a different part of healthy eating.
Okay, I'm picturing this. So walk me through it.
One card was all about, healthy foods just for women. Other one focused on what's best for babies. And then the third one, it showed a shopping cart with a dollar sign on it, symbolizing affordable options.
Love it. So visual, easy to understand, especially for people who might not speak the main language. What about the 4th card?
Ah, that's where they got really clever. The 4th card just had a big question mark on it. It was an open invitation for the women to share any other concerns or suggestions they had.
Brilliant. It gives them a voice, right? They can go beyond those predefined categories. So how did this whole card thing work in practice?
They got the women together in this comfortable setting and then asked them to stand next to the card that resonated with the most. Their main interest. It was amazing to see how engaged everyone was. They were actively choosing, discussing their preferences.
I bet there were a lot of interesting nonverbal cues too, beyond just what they were saying.
Absolutely. The team had people observing, looking for those little nods of agreement, the side conversations, even just hesitant glances towards certain cards. It added a whole other layer to the data, capturing those unspoken thoughts and feelings.
Wow, so they were gathering data even within the validation phase itself, so meta. What did this visual exercise actually reveal?
It was really interesting to see how it unfolded. 5 women went straight to the card about healthy foods for women. Another 5 chose the baby nutrition card.
Yeah.
And 3 women stood by the affordable options card, which, validated what they already knew about budget being a concern.
So it confirmed their initial hunches. What about that question mark card? Did anyone choose that one?
Yes. 2 women, they chose the question mark card. They said they wanted to learn more about how to actually prepare healthy meals.
So it revealed a need they hadn't even considered before. This whole validation thing is amazing. So what did the team do next? They had all this feedback. Now what?
Well, they brought in their collaborators, the volunteers and support workers, to help figure out the action statements. Those statements that bridge the gap between the analysis and actually doing something.
Right, the roadmap for change. I'm guessing there were some tricky decisions to make.
Oh, definitely. First, they had to be really clear about who their community of interest was. At first, they thought it was just pregnant women and women with new babies, to align with the public health program they were working with.
Makes sense, but I have a feeling it wasn't that simple.
You read my mind. They realized that most of the women they talked to had kids between 1 and 5 years old. Only 1 woman was actually pregnant at the time.
Ah, so they needed to adjust their target group a bit.
Exactly. And their public health nurse advisor, she gave them some great advice. She said, since this apartment building was a close-knit community, any information they shared about healthy food would probably benefit everyone. Pregnant women, new mothers, everyone.
Like a ripple effect of knowledge and healthy habits. I like it.
Exactly. But then came the question of how to frame their action statement. Should it focus on a concern, like what needs to be improved?
Yeah.
Or should it focus on a strength, using what they already have?
That's interesting. What did they end up deciding?
They looked at all the data, right? The lack of nearby grocery stores, the fact that the women always brought up affordability, even the general data about low-income families and diet problems. So in the end, they decided to focus their action statement on the difficulty of getting healthy food.
Makes sense. But they didn't just forget about the strengths altogether, right?
No, of course not.
Yeah.
Those strengths, like the women's willingness to learn, their strong community, the support from their collaborators, those would all be super important in tackling the problem.
It's about acknowledging the hurdles, but also recognizing what they can use to overcome them.
Exactly. To get organized, they used a 3-part table to map out their action statements.
Okay, break it down for me. What were the 3 parts?
First, they were specific about their community of interest. Pregnant women and those with young children living in that particular apartment building. Not just mothers in general, this specific group.
Got it. So we're super clear on the who.
Right. Then, they clearly stated the concern. Experiencing difficulties in obtaining healthy food for themselves and their families.
So that's the what? What about the 3rd part?
The related to part. That's where they identified what was causing the problem. In this case, it was the lack of clear information on healthy, low-cost food options.
So that's the part they can actually change.
Exactly. They also considered an action statement that focused on a strength, like the women's potential to get healthy food. The related to part for that one was their strong interest in learning about healthy food, plus the support from their collaborators and public health resources.
So they looked at both sides of the coin, the challenges and the opportunities. But ultimately, they chose to focus on the access issue. What happened next?
They were ready to move from analysis to actually doing something. But first, they had to document everything, make sure it was clear and transparent for everyone. They created this comprehensive report.
Documentation. The unsung hero of any project. What was in the report?
They had a clear format. It started with an overview of the major health issues facing the population. They used national, provincial, and local statistics to give some context to their work.
So they started with the big picture, then zoomed in on their specific community.
Exactly. Then they defined their community of interest really clearly, highlighting those unique characteristics of the women and children living in that building.
Specificity is key.
Right. And then they described how they did their assessment, the methods, the timelines, who participated. It's all about transparency, builds trust.
Like they're letting everyone see behind the scenes how they got to where they are.
Yep. And of course, they presented their main findings, the concerns, and the strengths, all backed up by data. Every single claim.
So it wasn't just their opinion, it was all based on evidence.
Exactly. They also described their validation process, how they got feedback from the collaborators in the community, and they even included a section on limitations, the things that might have affected their data collection or their findings.
It's nice to see that level of honesty.
They also talked about sustainability, how to make sure the project keeps having an impact even after they're gone. It's about creating lasting change.
That's so important. So many projects, they just fade away once the funding or the excitement is gone. So what did they recommend for next steps?
Based on their findings and the feedback they got, they came up with this list of actions. They were focused on improving access to healthy, affordable food. The report wasn't just a report. It was like a blueprint for the future.
That shows how committed they were to making a difference. Did they get to share their findings with anyone else?
They did. About halfway through, they had to give a presentation to their clinical instructor, their advisor, and the advisor's manager at the public health department.
So they got to showcase all their hard work and get feedback from the higher-ups. How did it go?
It went really well. They presented the key points from their report, emphasizing how important community engagement was. And they got a lot of praise for their work. Well-deserved, I'd say.
It's inspiring. All their hard work, their creativity, their collaborative spirit, it all paid off. But amidst all this, the data and the reports, how is the team doing, as people?
Well, they'd definitely been through a lot. They'd tackled all those complexities of data collection and analysis. They'd learned how to work together better, and they'd learned so much about the community.
It's like a journey, right? They all grew as individuals and as a team.
And at this point, they were starting to see the results of all their hard work. That transition from just collecting data to actually planning how to take action, it was motivating. They could see they were making a difference in the real world.
It's amazing how seeing those results can give you a boost of energy. It reminds you why you're doing it in the first place.
Absolutely. And it's important to celebrate those wins, acknowledge each other's work, appreciate how far you've come. Those moments are crucial for keeping morale up and keeping the momentum going.
Because teamwork is everything. So where does this all lead? The analysis, the focus on validation, the collaboration. What's the takeaway for our listeners?
The multi-language project, it's a perfect example of how powerful data can be when it's used thoughtfully and collaboratively. It's not just numbers on a page. It's about understanding people's lives and empowering them to make things better.
It's about turning information into action, bridging that gap between knowing something and actually doing something about it, and giving communities the power to shape their own future.
Yes. And it brings us back to something we talked about before, gap analysis. That difference between where things are now and where we want them to be. This project shows how data analysis can help us understand that gap and then figure out how to close it.
So what's the key message for our listeners?
Think about the communities you're part of. What's going on beneath the surface? What kind of data could you use to get a clearer picture?
And how can you help create positive change? Because we all have a role to play in building healthier, more equitable communities.
Exactly. Whether you're a nurse, a community leader, or just someone who cares, the things we've talked about today can help you make a difference. Keep asking questions, keep learning, and keep digging deeper.
It's really impressive, how the Multilanguage Project manages to blend that rigorous analysis with real community engagement. It kind of reminds us that data isn't just like cold facts and figures. It's about understanding people's actual experiences and then helping them create positive change.
Absolutely. And it highlights something we haven't talked about yet. Analyzing existing policies alongside the data gathered from the community.
Oh, interesting. I hadn't really thought of policies as data.
Oh, but they are. And they can tell you a lot about a community's priorities, their challenges, even the systemic barriers that might be holding them back.
So like if there's a policy that makes it hard for low-income families to get healthy food, or one that limits their participation in community programs, that's a sign that something needs to change, right?
Exactly. It's like data baked right into the rules that shape our lives. By really digging into those policies, we can identify areas where we can advocate for change.
So it's not just about understanding the community's current situation, it's also about looking at the systems that created that situation in the first place. But analyzing policies, that sounds pretty complicated, especially for nurses who, might not have a legal background.
It can be, and that's where collaboration is key. We need to bring nurses, policymakers, community leaders, and residents all together. Make sure those policies actually promote health and equity.
It's about, breaking down those walls between different groups, bringing everyone to the table and using data to make decisions that benefit everyone. But even with, the best data and the best intentions, there are going to be challenges, right?
Of course. Community health assessments, they're not always smooth sailing. You're going to run into unexpected obstacles. Different perspectives might clash. You might find new information that forces you to change direction. That's just part of working with complex systems.
So how did the Multilanguage Project team deal with those bumps in the road?
They were super adaptable and resilient, which really shows how committed they were. When they came across conflicting viewpoints or unexpected data, they didn't just ignore it. They leaned into it. They questioned their assumptions, had open discussions, and looked for solutions that respected the community's voice.
It sounds like they saw challenges as opportunities to learn and grow. They were constantly refining their approach as they went along.
Exactly. And it highlights something really important. Data analysis is an iterative process. You don't just do it once and you're done. As you learn more, as the community's needs change, your analysis has to change too.
It's a journey, right? A journey of discovery and collaboration. And it's fueled by that shared desire to create positive change.
I like that. And as we wrap up this deep dive into community health assessments, I want to leave our listeners with one final thought. Data can be a powerful tool for good, but only if we use it ethically, responsibly, and with respect for the communities it represents. Let's use what we've learned to create a world where everyone has the chance to thrive.
Beautifully said. And thank you for joining us on this deep dive. We hope you've learned something valuable and are feeling inspired to make a difference in your own communities.
Keep asking questions, keep learning, and keep diving deep.